Okay, ma'am.
Okay, so if you've read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
Okay, according to the scenario, I will manage the patient according to the ATLS guideline and follow the ABC approach.
Good.
Here, I will manage the patient in HDU, and the GCS is less than now 8, so I'll consider the endotracheal intubation immediately the patient, and
Okay.
the adequate circulation and oxygenation I will maintain and involve the neurosurgeon, ITU register, and the anesthetic register for
Okay.
managing purpose and doing the CT scan of the patient.
All right. Just 1 second. You said you'll manage the patient according to the ATLS protocol. So have a look. After managing airway, you checked for airway and then
And
you
cervical
decided,
spine immobilized.
yes, you
Yes,
forgot
ma'am.
that.
Yes, ma'am. I have to say yes, ma'am.
Yes. All right. Next.
Then I will I'll do the CT scan
Yes.
of the
After
patient.
CT scan. Yes. What is the criteria according to the NICE guidelines for requesting for a CT scan after head injury?
Okay, ma'am. Some major criteria, some minor criteria. Major criteria includes the GCS less than 15 2 hours after injury, the open or deep pressed skull fracture, the sign of base of the skull fracture includes the hemotympanium, Raconi battle sign, and the CSF autoria or rhinorrhea, then focal neurological deficits, vomiting more than 2 times, and the minor criteria includes the retrograde amnesia more than 30 minutes, and the difficult mechanism of the mechanism of the injury. If the eject the person eject from the vehicle, or the stuck by the passenger, or the person stuck by the vehicle, or the fall from heights 3 feet or 5 steps.
Okay. Thanks. Please tell me why patient on arrival had Glasgow Coma scale 15, but 15 minutes later it was found to be 8. What might have
Okay.
happened to the patient?
Yes, patient may suffering from the extradural hematoma, that is the lucid interval.
Okay. What is lucid interval? Please define.
Okay, ma'am, it's a temporary improvement of the patient condition after a traumatic brain injury. After the patient condition deteriorates with rapid decline the conscious level.
Okay. How much should be the normal values of intracranial pressure
7 to 15 millimeter of mercury.
in supine positions? Okay.
Yes,
Are there any ways by which you can measure intracranial pressure?
yes, ma'am. The two system, invasive and non-invasive. Invasive includes the interventricular catheter, intraparenchymal probe, subarachnoid probe, extradural probe, and non-invasive includes the tympanic membrane detachment and the transcranial Dopplers.
Okay, please tell me what is the pathophysiology behind the increase of intracranial pressure. In other words, I want you to discuss Monro-Kelly hypothesis.
Okay, ma'am. Okay, ma'am. The skull is a fixed box containing the blood 80, brain 80%, blood 10%, and the CSF 10%.
Cerebrospinal
The
fluid,
cerebrospinal fluid 10%.
10%, yes.
The intracranial pressure and the volume relationship is governed by three components.
Yes,
If the volume of one compartment is raised, the compensatory two compartment volume will be the reduced to prevent the raised intracranial pressure. If there is intracranial pressure raised more than 25 millimeter of the mercury, this relationship will be imbalanced and there will be the herniation of the brain.
right. Okay. Please tell me. Right. Okay, in this condition, if you come across that patient has presented with increased intracranial pressure, would you still go out and ask for lumbar puncture?
No, ma'am. I'll not
Why?
not
What
do
is
the
the
lumbar
risk?
puncture because
Yes.
there is a risk of brain herniation and the coning.
Okay, very good. Please define the term Cushing triad and how is it different from Cushing reflex? So you have to tell me two
Okay, Cushing
definitions.
reflex is the mixed vagus and sympathetic uh, condition
Stimulation.
that
Yes.
stimulation which occurs due to the rest ICP and which leads to
Intracranial
the
pressure. Yes.
rest, sorry ma'am, intracranial pressure which leads to ensure adequate cerebral perfusion pressure that leads to bradycardia.
And and it leads
As
to
Cushing
hypertension as
tyres,
well. Okay,
yes,
yes, and Cushing
hypertension,
triad.
yes, ma'am. And Cushing tyres includes the hypertension, bradycardia, and the
Dyspnea.
irregular respiration.
Good. Okay, please tell me. All right, what you said patient has 8 Glasgow scale and you'll intubate the
Yes,
patient. What are the
yes, ma'am.
benefits of intubating a patient? Why would you go ahead and intubate the patient?
Yes, for maintaining the oxygenation of the patient.
Yes, one reason. And
And
one benefit rather, more.
sorry, ma'am, I know
When
one.
patient has risk of hypoxia, when there is risk that patient might aspirate, and when
Yes,
patient
yes,
is insufficiently ventilating. Okay, right. Please tell me, who would you involve in the management of this patient?
yes, ma'am. I will involve my consultant as well as the neurosurgeon, ITU register, and the anesthetic register.
Okay, you asked for CT scan. Just imagine this is the CT scan you asked for. Can you help me and read it, please?
Yes, ma'am. The CT scan of the brain showing the biconvex hypertension lesion
Yes,
in the right side of the brain and the midline shift and compression of the ventricle.
very good. Okay, right. Please tell me why. Okay, what my if a patient presents with increased or raised intracranial pressure, why would it cause dilatation of the pupils?
Yes, ma'am. Due to the compression of the oculomotor nerve, which carries the parasympathetic fiber that unopposed sympathetic to the pupil that cause the dilatation of the pupil.
Okay, once you have intubated this patient, what measures further would you take to decrease the risk of brain injury?
Okay, ma'am. I will consider the sedation of the patient to prevent the staining, the maintain the hypothermia, head in up 30 degree, and the hyperventilation to maintain normocarbia of the
All
patient.
right, okay. How would you
And
take care of the, yes,
care about the fluid management to avoid the over hydrate.
overhydration?
That will leads to the cerebral overhydration leads to cerebral edema.
Yes, so you have to be careful with fluid. Right. Thank you so much.
Thank you, ma'am.